Hi, I'm Dr. Shivadev, Psychiatrist and Sexual Health Specialist. I have about 16 years of experience in dealing with psychosexual health and mental health too. My clinic is in Koramangala. I'm a co-founder of PassionFruit Top-Notch Wellness. Homosexuality is definitely not a mental illness. It is seen as a part of normal variation because sexuality is very fluid. It expresses differently in different individuals. So earlier, homosexuality was seen as abnormal, but not anymore. Even if you look at various institutions and DSM has removed it, the American Psychiatric Association has removed it from the Diagnostic and Statistical Manual in 1973. WHO has declassified it in 1990. And so diagnostically, medically speaking, it is not seen as a mental health disorder anymore at all. The Indian Psychiatric Society also condones the same and says that it is not a mental health disease. 5 to 10% of normal adults identify themselves as homosexuals or bisexuals. So if you understand sexuality, we are on a spectrum. Some of them are completely heterosexuals, some can see as bisexuals and homosexuals. So if we understand the fluidity part of sexuality, we can realize why some people may feel different and it is normal for them to feel so. In society, heterosexuality is seen as a norm. So therefore, when men or women identify themselves as homosexuals or bisexuals, it's quite obvious when they look outside, they see everybody is a heterosexual. So therefore, they're not able to understand what they feel is real or not. So normalizing homosexuality and bisexuality can help the individuals and couples to adjust according to their own sexual fantasies and orientations as well, helping them to destigmatize it so that they don't have to suffer internal frustration, guilt, anger, sometimes leading to suicidal ideas are also seen. Heterosexuality is seen as a norm in a society. Cultural beliefs, religious beliefs and family beliefs adds on to this. So thereby, when someone who identifies as homosexual or bisexual compares themselves to these belief systems, they obviously feel that they're abnormal. So and along with that, there's a lot of internalized shame, guilt and stigma for them to freely express themselves. So hence they feel more abnormal rather than normal. But if you look at the sexuality and the fluidity part of it, it is important to know that actually these things are normal part of the human sexuality spectrum and there's nothing abnormal about it. Conversion therapies or trying to convert someone who is homosexual or bisexual to a heterosexual orientation is not definitely recommended because this leads to deep mental health struggles. When you try to convert someone to that, it causes repressed emotions to come up. Anxiety can be a part of it. Self-injuries, suicidal ideations, extreme depression and anger, frustration, all are part of the problems if someone tries a conversion therapy. So I do not recommend conversion therapies at all because this causes deep distress in an individual. Let's take an example. If you are a heterosexual, if I ask you to actually go male to male when your interest is actually with the women, how would you feel? That's exactly how someone who has homosexual tendencies or bisexual tendencies can feel. So thereby, do not promote conversion therapies at all. Therapies for homosexuality or bisexuality doesn't mean we're trying to do a conversion therapy, but rather it's important to make the individual feel understood, help them to accept themselves as they are. Also, train them on self-compassion, overcome the stigma, anger or anxiety that they may be facing. Sometimes it's also important to work with families of such individuals to help them accept their wards or their children as they are, making it much better for the individual who is having these problems and also for the family to accept it. And a larger picture of educating people about these things in the society can also help these individuals to integrate themselves into the society very easily, thereby creating a very holistic environment for everybody to be themselves as they are.